Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Associate practice is a very popular transition from dental school into private practice for recent dental graduates. Here to discuss associate practice from an associate's point of view is Dr. Gregg Sutherland, who has been in practice for nearly 1.5 years in Denver, Colorado. Gregg, do you think that associate practice is a favorable route of entry into private practice?
I found associate practice gave me the opportunity to find out what dentistry was all about without saddling myself with the burden of a brand new practice right out of school.
Are there some other things that maybe you would look at that made it a desirable decision?
Yeah, I found that I didn't know really what practicing dentistry was all about and the day-to-day operation of it. I didn't know exactly where I wanted to live, and being an associate gives you the opportunity to try it without getting in over your head.
The situation of working for another dentist, did that seem to be a favorable thing? Did you learn from this person?
Oh, definitely. There's a lot of things in school that you do by a set procedure, and that's the only way you do it. As an associate, you find out many alternative procedures, especially if you practice with an owner dentist who's been in practice for a number of years. He's developed many procedures, and you can always find one that'll help you.
When you went through the process of locating in Denver from Ann Arbor, what were some of the things you looked for in selecting that particular office or offices where you work?
Well, the one office I work in, the basic reason I went to practice with him was the fact that our philosophies were similar, and I felt that we were very compatible, and I could fit into his system.
How did you find that out?
Talking to him, and while I was still in school, I went out to visit him and find out how he ran his office, how he treated his patients. I just looked over his shoulder.
How did you have contact with that person? Was it through an ad or a family friend? Or?
Yeah, basically I had some family that lived in Denver, and I was visiting them, and he had been their family dentist. And while I was in school, I tried to get to different offices to find out what it was like in the real world, and looked over his shoulder one day and liked the way he practiced, and he seemed to like me, and it just happened he was looking for somebody.
When you made the journey to Denver the first time and talked with him, when you got to the office, did you have any other things that you were looking for in the conversation besides practice philosophy?
Well, to become an associate, I think you have to cover a whole range of variables, and I think philosophy, compatibility are two very important things, but then there's how somebody practices. Do they keep their instruments clean? Do they keep good records? And do you have access to the records? And what's the staff like?
Facilities and equipment?
Yeah, many, many things to consider, I believe.
Did you like the equipment that was available there? Was it?
Yeah, I did. He's practiced for 23 years now, and he's tried to keep up with things. He's not afraid to spend a little money to update the office, and he tries to keep current on techniques. Does an awful lot of postgraduate seminar work and things like that.
I presume that also the issue of financial arrangements between you and the owner was something of significance to you.
Oh, yes. First thing I wanted to do was write everything down. So he and I spent, probably a total of 4 or 5 hours actually sitting down, hammering out the details and what kind of financial arrangement we would have.
Do you like the idea of a written agreement?
I definitely think writing it down is absolutely necessary, because 2 months down the road, he asks you to pay a lab bill, and in your agreement it says you're only supposed to pay half the lab bill. And if you don't have it written down, he may not remember, and you may not remember.
Would you consider that a legal document, or is it a...
No, it's a gentleman's agreement, but it's written down for reference is basically what it's for. Getting into a legal document that early in an associateship, I think, is a little bit dangerous, because you can get yourself into things that are binding that you know very little about.
So it's a compatibility agreement?
Basically.
Just to avoid problems later on.
Mm-hmm.
I'm wondering, when people enter an associateship, if they did not have such a written agreement, I wonder how often they would run into problems. Have you had any discussions with other associates that did not have a written agreement?
Yes, and I've seen it go both ways. I've talked to some who have had legal documents and who were tied in. They wanted out and they could not get out. A friend of mine had to buy his way out of a legal document because he was associated with a man, wanted to get out, start his own practice, and in the document it said that he could not until a certain date or until he paid so much money to buy his way out. I've also known people that were on the other end and it was too lax. They didn't have anything written down and it just got to be kind of a domino thing. One problem led to another as far as finances went.
It seems to me that in a written agreement that would be legally binding to hold someone there, that wouldn't be very practical from the standpoint that if one or other of the parties was unhappy, that certainly you wouldn't want to be held together by an agreement and continue the working relationship like both people would want to dissolve it. That the idea of a written agreement from the standpoint of compatibility would be a better approach. Yeah. What are some of the things that you would include in such an agreement? Some things that have the potential of becoming problem areas?
Well, the foremost thing I think is how the finances are handled. How are you going to get paid? A percentage of collections, a percentage of production, or
well,
what?
Let's touch on that. How do you think the young associate should be paid? What should be the arrangement in that from your point of view?
Well, through my own mistakes, I found out that going to a practice and coming out of school, you have very little money, or most people do, I think, and getting into a practice where they pay you on a percentage of collections is great, except when you first start out, you have no collections, and you go through a long, dry period before you get any payment. I found the ideal thing. I got a second associateship after I started the first one, and I found the ideal way was to get paid on a percentage of the production for the first 2 months or 3 months or 6 months, whatever you can work out, and then switch back to a percentage of collections. That way it gives you a little padding and gets you going.
Did you find that it did take quite a while? What was the latent period between the time that you billed and you started receiving monies from patients?
Well, I found it very difficult for the first 6 to 8 months in the one practice I was in. And that was due to insurance and people not paying and a small patient load.
As you looked around at associate arrangements, did you find there was a great difference in the type of splitting of the fee between the owner dentist and the associate dentist?
Yeah, there's many different formulas, but it all boils down to somewhere between 40 and 50% for the associate dentist. And that's pretty reasonable because most dentists run at least 50% on their overhead. And I found, after looking at all these different formulas and things, that usually it works out to around 40 to 50% of collections.
Of collections.
Right.
Within that framework, who pays the assistant, who pays the lab bill?
These were the things that differed. I work in one office, I get paid 40% of collections, and that's it. I have no lab bills, no assistance fees, nothing like that. I work in another office where I receive 50% of collections, but out of that I pay 100% of my lab bills and 50% of my assistance fee. So when it all works out, it's about 40%, just like the other one.
Do you have any say in what assistant works with you?
Both men that I'm associated with are very fair, and I have had no trouble with the assistants, but I feel confident that if there was a real problem, we could work it out, and I could choose the assistant I wanted.
Should one leave the practice and a new person is going to be hired, would you have a say in
Oh, most definitely. In fact, they wanted me to sit in on the interview or interview the girl myself before she was hired in.
In the agreement, aside from financial arrangements, what other things would be included that you think are important?
Well, probably the next most important thing to me was leaving an escape route, a way to get out of it. One reason why I didn't want a legal contract was so I could leave the practice if I wanted. We worked out a deal where 3 months' notice and either of us could dissolve the associateship that we had set up. And that seemed to work out real fair for both of us.
For any reason?
Yeah, for any reason.
You might just want to move back to Ann Arbor or something.
Right,
like
or
that.
he may just decide he doesn't like me, or we find out we're not compatible. And we found that that seems to be the best agreement because when you start off working with somebody, you just don't know what they're like.
Other associates and owner dentists that I've talked with often bring up the issue of working hours, vacations, emergency coverage, and the like. What are your feelings on some of those?
Well, we try and hit whenever you write up a contract or an agreement like this, I feel like you should try and hit as many variables as I can, but I think you have to be realistic and understand that there's no way you'll get every variable. So you try and cover yourself as much as you can and then work out the rest. For emergencies, there was no problem. We just would split it up. If he was going to be gone a weekend, I'd take it. If I was going to be gone, he'd take it. And both our numbers are on an answering service, so they can get either one of us. So it seems to work out pretty well.
If you see an emergency patient, do you collect the full fee or the percentage of the fee?
The percentage, because there is the overhead of seeing the patient in the office, so it's the same percentage as a regular patient.
What about vacation? Do you receive vacation pay under these agreements?
No. When I take time off, I don't get paid for it.
On your own. Does your owner dentist, or in this case, you are still working for two dentists?
Right.
In either of these agreements, do the owner dentists pay any your unemployment tax?
No,
or
in
anything like that?
neither office am I receiving any benefits at all. Again, coming out of school and working out these agreements, like I said, you can't cover every variable, and these were some of the areas that I neglected a little bit. And had I to do it over again, I would consider more things like benefits and vacation pay. But in an area that I went to, Denver has a lot of dentists, and they're not crying for associates by any means. So, you know, it's kind of like what the market will bear. You can't ask for a large salary in an area where there are a lot of people looking for the same job.
You mentioned having an escape clause in the agreement. Carrying that thought just one step further, what about patients? If you wanted to stay in the Denver area, do you have anything in the agreement that would allow you to continue the patients or have the patient's records or copies of the records or anything like that to use that as a nucleus for starting your own practice?
In neither associateship that I'm in have we worked out any kind of a detail like that. I may be in a little bit of a special case because in one office I plan to become a partner. And it's a gentleman's agreement that I will not practice within a 3-mile radius if I do leave, and that I will not take a large practice that I have built up there at his expense to go someplace else. And that's just a gentleman's agreement that I have with him, and don't feel I would ever change that. The other office is a very loosely set up type of agreement that's more of a handshake. We didn't really write much down, and haven't really considered taking any patients away from there.
Concerning patients within the working structure of the office, when a new patient arrives at the office, how is that patient assigned to you versus being assigned to the owner dentist?
At one office, the dentist is so busy that almost everybody that comes in gets assigned to an associate. At the other office, we're both still looking for new patients, and if I'm there, or whoever's got time, usually picks up the new patient. I'm still doing a lot of my own prophies, so I end up seeing a lot of new patients, and at the first exam I will do the prophy myself, and like that, because I do have the time.
I'm curious why you are involved in two associate agreements.
I mentioned the lag time earlier between collections and production, and the one office I'm in, I started there, and after 6 months I was pretty broke. So I looked around and found another associateship 2 days a week and practiced there, and he agreed to pay me a percentage of the production when I started. Well, that got me over the hump. He paid me for 2 months on what I had produced. Then at the end of 2 months, I made up the difference between the production and the collection. But by then it had caught up in the first office, so I could afford to make up that difference.
If you are busier in the second practice, why do you cling to the agreement in the first practice if you could get out of it? Yeah.
Well, I could get out of it. To me, there's more to the success story than just how much money I'll make, how busy I'll be. The first office I started in is a much nicer office. I like the people better, I like the area better, and believe it or not, there's very much of a difference between the patients. One office is in a blue-collar type area and has a lower dental IQ, if you want to call it that, and the office I plan to stay in is in what I would consider a white-collar area. The patients have a higher dental IQ. I enjoy the patients more. That sounds like a very, maybe a bad way to look at it, I don't know, or a very selfish way to look at it, but I find that that's what makes me happy, not just the money. I could make much more money at the other office.
We'll be back with more discussion on associate practice right after this management fact. We're discussing associate practice with Dr. Gregg Sutherland from Denver, Colorado. Gregg, does an associate keep separate financial records during the day in addition to the main records that are kept in the office?
Well, I found the office that I went into was not really set up for two dentists, and there was a little trouble with the girl handling two different accounts, and when we'd work on patients from the same family, the other dentist and myself, it would be difficult when a check came in to decide who got which money and how much. So I kept my own records and still do, just as kind of a safety valve and a check to make sure everything's going right. I trust the girl, but it's a difficult system when you're dealing with two dentists.
Do you copy patient addresses and phone numbers down for your own records in your record keeping?
No, I don't. I just keep track, basically, of my production and collections.
Some associate agreements are very protective of the patients when an associate leaves, and some have suggested that you make a list of the patients that you treated for purpose of at least sending them an announcement should you go on your own into solo practice, and give that choice to the patient.
Right. Well, I do it by name. I have a list of every patient I've ever treated, but I would have to go back and dig out all the addresses in that case.
But the owner would, in your case, would permit that?
Yes, I don't believe he'd give me a bad time. We had an agreement, a 3-mile agreement, but other than that, I don't see any problem.
I'd like to have you just look back over the past year and a half, and if you can recall some of the difficult things that have happened to you in this associate agreement. Are there some problem areas that you could share with us?
Yes, I found the number one problem is working out an associateship agreement, getting it written down, and so it's satisfactory to both you and the owner dentist. Once you get there and get started, probably the biggest problem was walking into a strange office, and at the beginning I didn't have enough patients to really justify having an assistant, so I treated everybody myself and looked through countless drawers looking for different instruments and things because I had no idea where anything was.
Just finding your way around.
It was very difficult. Other than that, that was probably the biggest hurdle to get used to.
In addition to the usual problems of moving to a new area and finding housing, I suspect. And, so
and again, being paid on a percentage of the collections, doing all that with no money.
Was finding an associate opportunity difficult? Several students have asked me from time to time, how do I go about finding an associate?
Well, I think there's different areas have different needs for associates. The area I went to, it really just kind of happened. It wasn't planned or anything. But while I was in school, I tried to get around and talk to different dentists, and one of the ones I talked to happened to need an associate. Finding the second associateship that I'm in was very difficult, and it took me probably close to a month to find another place.
Again, looking back, where are the bright spots? What are some things that were really outstanding in your memory over the last year and a half?
Well, one thing I found that was very enjoyable to me was to walk in with a case to the owner dentist and say, I've got this case and this problem, and how have you treated this kind of thing in the past, or have you, and can you give me any information or any ideas on how to treat it? And I learned an awful lot like that and found that very enjoyable, and also found it very enjoyable when he came back to me and said, well, you just got out of school, have they been treating this any differently, or have you seen any way to treat this? And it's a very enjoyable thing when you give him an idea and he says, yeah, that might really work, and he actually uses it, and it does work.
Does the support from him mean a lot to you?
Yes, I find the interaction very enjoyable and a little stimulating to be able to talk to somebody about a case and use his ideas and my own ideas and integrate them into a treatment plan.
If you were to start all over again from the day of graduation, would you do this again?
Oh yeah, I find being an associate has allowed me to do many things I don't think I'd been able to do opening my own practice. It's allowed me to find out whether I like dentistry day to day, whether I like the Denver area, and I've learned quite a bit just from these other dentists.
And self-confidence, I suspect, as well.
Definitely, and when you start out and you're slow, you can, if you come up with a real big problem, he can help you possibly, or, you know, he's got it set up already. That's one thing. I think if I started my own office, every time I came to a new procedure, I'd have to figure out how to set up all the instruments and equipment for it. This way things are set up in a very functional order since he's been at it for 20 years.
Thank you, Gregg. Our guest has been Dr. Gregg Sutherland, who is currently an associate dentist in Denver, Colorado. Join us again for other programs in this series that are designed to offer you a variety of perspectives on the management of a successful dental practice.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.